Hi, I'm Dr. Steve Pearlstein, and this is Second Opinion. Today we're going to talk about exercise and soft tissue injury, specifically how exercise can cause soft tissue injury, how it can prevent it, and how it can repair it. And as we get into this subject, I think it would be important if I defined some of the terms, because you may think you know what some of these terms are, and maybe you do, but there are many who may not, and I don't want those terms to be confusing to people. So one of the words, I said soft tissue injury, one of the words is tissues. Tissues is body material, and there's different types of tissues. Specifically, tissues mean a group of cells that come together that perform a particular function. So, what's a tissue? Skin is a tissue, and heart muscle is a tissue. Muscle is a tissue. So you can see there's different tissues, and obviously skin works differently than heart, muscle, so tissues have different functions. And obviously soft tissues are those that are soft and pliable, and hard tissues like bone. So there's that distinction. Now, I said soft tissue injury. What is injury? Well, injury, very specifically using the terms that I just introduced, is damage to the functional integrity of soft tissues. In other words, functional integrity means how well the soft tissue works. I mean, we take these things for granted. You don't think about how your skin's working, but your skin does work. And when there's any kind of damage to the ability of a soft tissue to do its job, that's an injury. So if you cut yourself, there is damage in that local area for the ability of the skin to function properly. It's not life-threatening on a little cut, but some, of course, injuries are. So that's a general term, injury, but now you know what it is in relation to tissues. And here we are talking about soft tissues. Now there's a few more terms here. I want to make sure that when we understand, when we're talking about soft tissue injuries, soft tissues are muscles, there's ligaments, there's tendons and other connective tissue. But the thing to understand is all of these, the muscles, the tendons, the ligaments, they all attach to bone. So if I have my arm like this and I want my hand and arm to go this way, well, there's a muscle that goes from here to here, and when it shortens, it pulls, and that's how the muscle works. So that's a very simple example of how that muscle, the bicep, works. But there's something good to understand here. The muscle actually doesn't attach directly to the bone. There's something in between, and that's a tendon. And if you look on a piece of cooked chicken, especially, of course, the leg, you will notice that there's some white gristly stuff attached to the bone, and then there's the meat. So in between the meat and the bone is the gristle, is the tendon. And that's just the way we're designed. The tendon is a much tougher, stronger material, different material than the muscle, and that's how we're designed. We're not going to go into more detail there, but that's the way it is. Muscle attaches to bone via tendon, whereas ligaments attach directly to bone. And ligaments tend to be shorter and tougher, but unfortunately, the way we're designed, and this is really important to understand, here's a distinction, they're all very easily injured. And the other distinction that I want you to get about injury of this nature is most of the time you have no idea how injured they are and if there's any consequences from it. We're all pretty much trained to understand that when there's an injury, there's pain, and when there's no pain, there's no more injury, it's all healed, everything's fine. It doesn't necessarily work that way, especially with soft tissue injury. And especially when we're younger. We are very active. Many of us play sports. We have falls, we have tumbles, we have innocent injuries that actually do a small degree of damage that add up over time. And when we're adult, we start recognizing that things don't work as well. So that, of course, as a chiropractic physician, I encounter in my office all the time with people coming in and saying, I don't know what happened, I didn't do a thing, I've been fine, and now I have this pain here. And we find that the joints and the corresponding soft tissues have been injured a long time ago and have finally gotten to a point like the straw that breaks the camel's back where their functional integrity is shot. And so they start to send out pain signals. So that kind of is a bit of a diversion. I wanted to get back to what this video is about, which is exercise. So how can exercise cause it? And actually, how can it prevent it and repair it? You know, it all boils down to something very, very simple. Regardless of the exercise that you are doing, whether it is one particular exercise or a program of exercise, this almost goes without saying, but because I encounter this in my office all the time, it must be said. When exercise is used improperly, and that is also including overuse of the exercise, it can cause injury. It's as simple as that. Now, this is a bit of a complex subject because what does overuse mean and what does improper use mean? Well, improper use is a little bit easier to understand because if an exercise has a particular set of instructions to it, and if you don't follow the instructions, then you're improperly doing the exercise and you're setting yourself up for the possibility of injury. If you overuse an exercise, do too much of it at one time, for example, you set yourself up for the possibility of injury. So how do you know if you're overusing? That's where you have to listen to your body. And my advice for people who are just beginning an exercise program is take it in baby steps. Very important to understand how important it is to prevent injury. Because if you overdo it, you will cause injury. So many times in my office I have people who are beginning an exercise program because they're overweight and out of shape, and it's been 20, 25, 30 years since they exercise, and perhaps the last time they exercised they were fit, maybe they were in high school or college, and life got in the way, and they are not the same person and they want to get back to that, but they're also 20, 25, 30 years older. And you have to take that into consideration. A lot of people just sort of default back to what they remember exercise to be for themselves, and you can't do that because, you know, you may not injure yourself. I'm not saying it's guaranteed that you will, but you're increasing the probability of injury. And remember, little injuries add up over time. So you may not be completely aware that you're doing disservice to your body, that you're doing injury to the soft tissues until it's too late, until you've been doing the same thing incorrectly, the overuse, or the improper use, over time. So be very, very careful. Personal trainers, if you trust a personal trainer, that's very important to get with one because they should know how to introduce you properly, or consult your physician, especially chiropractic physician, especially if that physician is fit like me. So if you are a patient of mine, you know that I talk with you about this all the time. Listen to your body. You must get really good at listening to your body. One thing that I learned in my entire professional education back when I was going to school and continuing on with continuing education over the years is such a huge lesson that I learned above and beyond all of the minute details of how the body works, is that the body never lies. It doesn't know how to. We just can have difficulty understanding what it's telling us. So you need to quiet yourself inside in order to listen to your body. Listen to it. Don't override the mechanism. Don't override the message. Listen to your body. And if you start young listening to your body and doing the right things, 20, 30, 40, 50 years later, you will be so thankful that you did that, because that allowed your body to continue to be fit through the years. So of course, starting an exercise program is best done when you're younger than older, but you can start when you're older. Just relax, take it easy, and take it in baby steps. So how does exercise repair injury? That's the third part. Well, it all ties into the proper use of exercise. When you have injury, properly using exercise and properly using the correct and appropriate exercise will help rebuild soft tissue. Now, we're not going to go into more than that. That's like the subject of another video, and we may not even get into that because that's specific exercises for specific conditions, and that's not the intent of the Second Opinion video series. You can consult one-on-one with your physician or your trainer and tailor a routine for repair of soft tissue injury. Just understand that soft tissue, that part of the healing process of soft tissue injury is exercise done properly. So I hope that you've learned something in this video, that you've gotten a lot out of this video. If you are watching this on Facebook or YouTube, please like my Facebook page, like the video on YouTube, and please comment below. I would love to know what you feel about this video, what you think of the content, the subject matter, the presentation, and also if there's other videos you'd like me to talk about. If watching this one sparked like, hey, why doesn't he talk about this? Please let me know. I've got a series of videos. Many of them have been done, many of them to be done, and you probably are going to think of something that I haven't thought of, so I hope so. So I would love to dialogue back and forth with you, see how you're responding to these videos. Again, I hope that you've gotten a lot out of this video. I'm Dr. Steve Pearlstein, and this is Second Opinion.